eat, to chew.
I'm so well. I had my doubts whether I should have gone this far, you know, and had the implants put in instead of just a nice set of regular dentures that had to have the liner changed every so often.
Yes.
And use polygrip all the time. And I'm so glad I made the decision I did. I have 4 implants in the upper
Yes.
and 4 implants in the lower. And they're titanium, so what happens is I think titanium is one of the only metals where your bone actually adheres to it. It actually builds into it. So, and the nice thing I like about Dr. Zym, he doesn't rush it. I see these videos of people going on these vacations down to Mexico and having these miniature implants put in, and oh voila, in 2 days they get to swim in the pool, and in 2 days they're done. They bite an apple, they go back home. But it takes more than that. You can't just have it done overnight. There's always adjustments. There may be some things that have to be changed, and that means they'll have to run back down to Mexico each time. So anyway, Dr. Zym would always have me in to do checkups continuously, checking to make sure that the implants were properly adhered to the bone and that everything was healing well. And then the sutures came out, and my gums went back to normal. And there wasn't really any pain. I never had any pain because when Dr. Rep did the sutures, I didn't even feel it. Yeah. And then some of them fell out by themselves, and then the other ones he just clipped and pulled them out, and I didn't feel anything.
That's wonderful.
And if you did have pain, they give you some always antibiotic and some painkiller if you have it, but I didn't even use the painkiller. I had a prescription for it, but I didn't have to use it. So anyway, the best day of my life was around Christmas. It was before Christmas, and the family gets together, has a huge Christmas, and I was worried that I would miss out on all the good food and everything I wouldn't be able to eat. But they called me in to have my finals put in, and one of the lab people was here to support Dr. Zym if there was any need, and they did a little preliminary fitting prior to that. They had done a fitting and weeks before that. So these were the finals. And when he put them in, there was just a little bit of disconnect, and the lab guy, Dr. Zym, went into the back area, came back out, and they snapped them in, and it was like my teeth.
New world.
I rubbed my tongue against the teeth, and it was like I didn't have dentures.
They feel natural.
They feel so natural. I've had them now, as you said, going at 6 months, and in July I'm due for a 6-month checkup on them. But I take them and I clean them very well at night, and I put them back in and sleep with them, and then I take them out in the morning and wash them again. And because with my other dentures I couldn't. I tried once or twice, but when the polygrip wore off, I found one of my dentures sitting on the pillow in bed.
Oh gosh.
So these are so good.
They are
no movement, but a little push down, and they pop right out.
That's
but
wonderful.
I can eat apples, corn on the cob, steak, chicken wings, riblets, Snicker bars.
Wow.
My favorite. I couldn't eat with the other ones because my 2 dentures would come out with the Snicker bar if I bit down and pulled it out. So I'm so satisfied because for the rest of my life now, I have almost another set of teeth. I don't realize them being dentures because there's no wobble, no movement whatsoever. And of course I smile for pictures now.
Yes, and you look phenomenal. Well, thank you so much for being willing to do this.
Oh yeah, my pleasure. As I said, I am so satisfied. Again, I can't say enough about how good Dr. Zym and Dr. Rep are.
And you really are a wonderful patient.
Well, I keep coming back. That's
we
how
love
good
having
they are,
you as well. So thank you very much for your time.
You're welcome. Thank you.